Hello, Dr. Bridget Malawi here. It has been a little bit of time since I did one of these videos, but I am aware that a lot of people have been asking me to share a little video about the new variant, the Omicron variant of COVID-19 virus. So just a bit of background and context into this variant. It is called Omicron, but I guess everybody can pronounce it as easily as they want to do so. This variant was first isolated in Botswana in around the first few weeks of November, and then South African authorities also were able to isolate it in their country from their samples. And the South African authorities informed the World Health Organization about this new variant around the 24th of November. In between then and now, the World Health Organization has declared this variant as a variant of concern. WHO often receives other inputs from about all sorts of other variants and mutations. As you're aware, COVID-19 continues to mutate because of the way that it replicates, and not all the mutations are of concern, but this one was seen to be of concern mainly because of the number of mutations it has and where the mutations are. The mutations are located in places that often might make it easier for it to evade the immune system and potentially be able to transmit faster or more easily. And so these are things that make it a variant of concern. Just to provide some context, I think one of the first key questions a lot of people are wondering is, so if South Africa and Botswana were the first to identify it, is that where it originated? So in reality, no, that's not true. We are seeing a number of countries have already started to isolate in their samples, and some of them have actually isolated in samples that were seen before South Africa and Botswana identified theirs. And even some of these samples have for people that have not been to South Africa or Botswana or the Southern African region. So it is possible that it could have originated anywhere, and that maybe that person brought it to South Africa. So there's still a lot of investigation right now going on in terms of determining exactly where the first mutation happened. South Africa and Botswana just happened to be the first countries to report it and identify it. That's a key question to address. Another question that a lot of people are asking is, so there's a new variant, what does that mean? Is that what is it causing? So what we know so far, and I think just to be very clear, is that a lot of the information we will get clearer as more cases are identified and as more countries are able to get more data. A lot of the data that is coming out currently is mainly from the South Africa region, because South Africa is seeing a rise in their case numbers, and so they have a little bit more experience and not cases to report on this new variant. But as I've said, that it's been seen that because of the mutations, there's worries that it might be transmitting faster and so forth. So far, what we've heard from the South African authorities, based on the cases that they've had, mainly especially from Pretoria, Tshwane, where it seems that that's where most of the cases are in the rise. They've seen that it is slightly milder than what they were seeing in the Delta variant, so not causing as much serious illness. Again, it's very early days. We might be able to see more and get more data as more cases are identified. They're also seeing that it is in slightly younger people, but not children per se, but just younger age group, maybe around the 20s and 30s or so. And also that it is that people who are infected are often also even those who are fully vaccinated. So again, it's just a matter of more data that we are getting from it, the more we will know about this variant. Does it cause more deadly disease, and does it transmit faster? We will get to know a lot more as more data comes out from many of the other countries. How does that affect you and me? I think that it's important to identify and realize that COVID-19 is still the same disease, and so the same preventive measures, the same measures that we've been implementing, physical distancing, hand washing, wearing of masks, and most importantly, vaccination is really important. Now, I did flag that some of the cases that have been identified are still in fully vaccinated people or people who have not been vaccinated as well. So we do know that vaccines, you will still potentially get infected with COVID-19, even with the Delta variant and other previous variants. We knew that getting vaccinated might not necessarily prevent you from getting infected with COVID-19. However, we are aware that because of the way that the vaccines promote your immunity, you're probably going to be protected from severe illness and death. That is the real value of the vaccine. So the vaccines are still important, and I would encourage those who have not had their vaccinations or were delaying getting their second doses to really consider getting those doses in, because you will then be able to at least prevent getting severe illness and death. And we are anticipating that potentially the vaccines will still work. They might work slightly less, and we still need to find that data. We're still waiting for that data, but at least we are anticipating that the vaccines will continue to work to prevent severe illness. And then I think another question that I've heard from a lot of people is, so does that mean Malawi is going to go into a fourth wave? This is often a hard thing to say, but it is likely, very highly likely, that we will go into a fourth wave, specifically because South Africa is experiencing a very rapid rise in their cases. And we know that the Malawian cases usually follow the trend of South Africa because of the close communication and travel between the two countries. We also know during the festive period that a lot of people will be traveling between the two countries and returning to Malawi. And we've seen that often a lot of our cases are do trend towards South Africa. So in terms of this festive season, we do anticipate we might see a slight rise in our case numbers. We're already starting to see some of the numbers start to creep into the double digits. We're going to be tracking that carefully. But again, it's really important to realize that, yes, while we might anticipate getting a fourth wave, the Omicron variant, we will be tracking and understanding it. But it's important then to also realize that all the measures that are still in place apply. I think that the government and authorities will then make decisions around restrictions as necessary and as fit. But for ourselves as a day-to-day, as we learn more about Omicron variant, get to learn about it, get to understand, and keep yourself informed. I will do more videos about this as more information comes around, but stay safe and stay informed, and try and get information from credible sources. Thank you.